Hello everyone. Today I'll be going over the bleeding time test, pretty much, and we're going to take it step by step so you can understand each and every part of it, and because pretty much it's all pretty much linear. All you have to do is just follow each step, and we're going to take it one by one, and so you can all see how it's done, so it's not all that difficult. We're just gonna take it one at a time. Okay, here we go. Now, the first thing you want to do is you want to check this. This is called the requisition form. This will tell you exactly what the physician wants done to our patient, to the patient. Also, will have the patient information on it, and also any and all other pertinent information that you'll need for the procedure you're about to do for the patient. The next step is you want to greet the patient. You want to identify yourself, and also you want to identify the patient to make sure that this is the correct person you're doing the procedure on, pretty much. So I'm going to say, hello, my name is Ricky. I'm from the lab. Would you please give me your first and last name?
I'm Mrs. Simmons.
Okay, see, I've identified myself to the patient, and now she's identified, and now I've confirmed, like normally, so on the requisition form, it will have, their first name, the date and time, whatever we do. So it would probably say Amisha Simmons on there, pretty much. So yeah, so now I know it's the correct person, so now we can begin. Now, the next thing you want to do is make sure you have everything. You want to assemble all your equipment and make sure you have everything ready for the exam. So for this one, we're going to need a lancet. Grab our gloves, blood pressure cuff, we have our filter paper, we have our band-aids, sterile alcohol pads, 70% isopropyl. That's the standard, or what we use for a lot of procedures such as this. And also we have our gauze. So now that we have everything, we need to do this procedure. Now the next step to do, we're going to wash it. So we're going to wash our hands. Now normally you can go to the sink and do the whole thing, but it's always quicker to use some hand sanitizer, alcohol based. We're going to get a couple of squirts, and then we're going to make sure that it covers every surface of our hands, all the surface of our hands, pretty much. Now that then we let them dry, and we keep going until it feels pretty much dry and stuff like that. Make sure there's nothing else on it. Okay. After we've done that, it's time to don our gloves. You can do it either way. You can do either which way you want. You can do left hand first, right hand first. Since I'm right-handed, I'm gonna put my left hand glove first. But like I said, it really doesn't matter. Don them. Being a little difficult. Put these on here. Okay. Okay. Got our gloves on. Now the next thing you want to do, you want to position your patient we're going to put your patient in a position that they're most comfortable in. So normally like sitting up, and this is a good position, nice seated gesture like this. If they're laying in bed, if they're in the hospital laying in the bed, pretty much, like a nice supine position, maybe like a 45-degree angle would be a good thing to put them at, pretty much. So since she's in a comfortable position, so we can begin. Now the next thing you want to do, you want to explain the type of procedure you're going to do. So obviously, now Miss Amisa, what I'm going to be doing today is called a bleeding time test. Now this is to test your platelet function, or then platelets are the cells in your blood that form clots whenever you're injured or things like that. And we're going to also test how fast your body can form clots, pretty much. So we're going to see how fast your body does, and we're going to time you. We're going to make a small incision, in this portion of your arm right here, and And when we do, and when I make the incision, I'm gonna time it, and we're gonna see how, until your blood stops, basically. And every 30 seconds, I'm gonna be removing your blood until your blood completely stops. So that's pretty much what the bleeding said, that's what the bleeding time test is. Do you understand? Okay. So now we've done everything, we've explained it, so now it's time to get to it. So normally now it's time we're gonna begin the procedure. We choose the incision site. We're gonna choose the incision site to where we're gonna do it. It'll normally be in this region near the antecubital fossa, maybe a few centimeters away from it. This will be a good region right here. Now that we've selected the incision site, we take our sterile alcohol pad out of the pack. We disinfect. We use small concentric circles going about 2 to 2.5 centimeters out. You don't want to go too far out, pretty much. So now that the region is affected, now we apply our blood pressure cuff. It's just we open it like so, readjust it. Take your arm, we're gonna slide it in. We put it on the anterior portion of our arm, or the palmar side of another name for it. Where's the flap? There's the flap. We close it. So we close it down. Now it's in place. So now the next thing we want to do, and we rotate this device up the gauge up so we can see. Now the next thing we want to do is we want to increase it to 40 millimeters of mercury, pretty much, because that's what we need for this. As you can see, we're at 40 millimeters of mercury, which is we need 40 millimeters of mercury, which is what we need for this procedure, pretty much. Next, after we apply the blood pressure cuff, we take our Now we're ready to begin. We take our lancet, we press down.
No.
Okay, we take our lancet, place it on the area. So place it on the area where we want it to, so this area right here, and we press down. And as you can see it's bleeding. We take our filter paper, we wipe away the first portion of blood. Then we take our timer, and now we start timing. And every 30-second interval, we wipe the blood away. And as you can see, we keep doing this until she stops bleeding. And it's 23 seconds, 24, 26, 27, 28. Another wipe, 30 seconds. Keep checking. And as you can see, she stopped. As you see, she stopped bleeding. So then we pause it, and we pause it. So as you can see, it took her body 46.71 seconds to stop bleeding, that's good. Said that's good. Anywhere from 1 minute to 9 minutes. That's the normal range for the bleeding time test. Now from 9 to 15, that's relatively high. There could be some platelet dysfunction there, or some other genetic factor or abnormality that may keep it from bleeding. That may keep her body from clotting or what like that. Anything over 15 minutes, that's critical. You need to stop the test immediately and have them apply pressure to that, because then there's something wrong with her platelets, with her clotting, things of that nature. Now there are some diseases that may cause an abnormal bleeding time, and it could be like leukemia, myelodysplastic syndrome, what else? And other things of that nature. Vitamin C deficiency. Alcohol intoxication, other factors like that could cause a high bleeding time, pretty much. Now back to that. Now we see she's done bleeding. Now she's finished bleeding. We take our bandage. You can use gauze. You can use gauze if you need. You can use cotton or gauze if you need. And lid on both sides, and we apply the bandage to the incision site. We release the air. We release the air from the blood pressure cuff. We remove the blood pressure cuff. And after we remove the blood pressure cuff, we've applied the bandage. We take all of our U-sharps and we put them in our sharps container. Make sure, and your sharps container has to be labeled with the biohazard sign, and it must be leak proof and puncture proof. So no one can get poked, or so no biological fluids will leak out of it. After we dispose of it, we remove our gloves. The key is to never touch the part of the glove that you use for the procedure, and that's pretty much it. That's how to do the bleeding time test. Thank you so much for watching, and I hope you enjoyed it. Thank you.